come to your homes, your offices, and wherever you are with our program to empower you. Tonight, we're still going to talk about health. Tonight is the last night we're talking about health this month. And once again, we have our own Dr. Prissy and Deacon Gatti. You would like to say something before we start?
Yes, I'm Prissy Compson. I've been with you for, about going on 4 weeks now?
Yes, 4 weeks.
Deacon and I have been here for about 4 weeks now. And I'm a nurse working in nursing leadership in population health. And so managing the patients in the community and working with primary care providers to meet quality measures.
Yeah.
Hi, and my name is Nick Gatti. I'm glad to be in your presence tonight. Thank you for welcoming us into your homes or wherever you are tonight. We want to tell you that we appreciate your company, especially these past 4 weeks where we've had to share with you the few things that matters with our health. And ultimately to this week, right? Today is the last of the month, the last session for the month.
Right.
And so, again, my name is, for those of you who haven't been with us from the beginning, my name is Nicholas Gatti. They call me Deacon Gatti. I'm a nurse by profession also. I work in nursing leadership. I work in critical care. I work in the Mesta Washington Hospital Center here in Washington, D.C., where I manage the medical intermediate care unit.
Thank you very much. So this month has been dedicated to our health, and we've learned a whole lot of things, from body fat to stroke and everything. And tonight we are ending with cardiovascular diseases. We're going to learn about cardiovascular diseases, and we're going to learn how to keep ourselves healthy. So tell us, what are cardiovascular diseases? What are they?
Yeah, so cardiovascular diseases, they have that name because they're a group of diseases that are usually related to the heart and blood vessels. And so another name for it is also, you also hear heart disease. It's the same thing. Heart diseases, cardiovascular diseases are the same thing. But one theme that you will usually see with cardiovascular diseases or heart diseases is a process we call atherosclerosis. So we had talked a little bit about atherosclerosis last week when we talked about stroke. We probably did not call it what it is, the term, but it is essentially a buildup of plaque. And we mentioned that plaque is fatty deposits. So when you have these fatty deposits, which is plaque buildup, they eventually going to form a blood clot, which can start to cause some diseases for your heart. And so we see that in most of the heart diseases, this whole process, and because it really damages your arteries and your blood vessel walls. And so that is kind of, in essence, what make up these conditions, and they can probably talk a few about those, what makes up what it is called cardiovascular diseases or heart diseases.
Thank you very much. So do you want to add something to it, or do you want to tell us the different kinds of diseases that make up what it's called?
Yeah, so just like Dr. Compson said, right. Cardiovascular diseases are, simply diseases of cardio, heart, and vascular vessels. And they have various types, too numerous to talk about. But the big ones are what we are trying to highlight on. And obviously last week we spoke to you about stroke, and stroke happens to be cardiovascular disease as well. But tonight, I believe, since we've spoken about stroke, we are thinking about the heart attack, heart failures, arrhythmias of the heart, valve diseases, and diseases that leads to blockage of the vessels anywhere in the body. PE, PVD, peripheral vascular disease, and all. So, we're probably going to eliminate this for now. Yeah. And as we continue, maybe some more will pop up.
All right. So, if I heard you rightly, you mentioned heart attack, right? So, let's take them one at a time. Can you talk to us about heart attack?
Heart attack is basically a condition where blood vessels supplying blood to the heart muscle itself. You know, the heart is pumping blood, but it has to take blood to itself, its own muscles, to work. Because there's a blood that carries oxygen. The oxygen is what is needed for all body functions to happen. So if for some reason the blood supply to the heart muscle itself is impaired, let's say by blockage, as Dr. Kumsin has said, then any region beyond that block where the blood, you know, the vessel was supposed to supply blood to, will begin to die. And if that happens, that's what we call heart attack.
Heart attack. So just to ask clarification, so how do we know that has happened?
Oh, how do we know? Obviously, you would feel that there will be signs and symptoms,
Okay.
and then it can be confirmed, you know, by, you know, the various tests, right? Because some of these signs and symptoms are, you know, symptoms that you may face in other conditions as well. So, of course, there are classic signs and symptoms, but until the doctor does the, you know, the necessary test and say that it is, make sure it is, we can't rule out anything.
So tell us some of the warning signs. What are some of the warning signs?
So before we even go into the warning signs, it is important to note that just because somebody suffers a heart attack doesn't mean they're going to die. Okay.
Thanks for clarifying that.
Because a heart attack, there are people who suffer a heart attack and still, you know, they get treated. They're able to, you know,
lead their normal life.
Lead a normal life and very productive life. They go on to live their lives as though nothing has happened. But obviously, once you've suffered a heart attack, you have to make certain changes in your life, because anytime you suffer a disease or something, even if it goes away, there is a chance that you may suffer that again. And so now you cannot live your life as though nothing had happened to you. So you have to begin to put some changes. And usually you can work with your doctor, and they will help you, you know, on how you're going to ensure and guide yourself against risk factors and stuff like that to make sure that it does not happen again. So the things that can alert you that you may be having a heart attack, a couple of things. So chest pain is very classic, is cardinal. And if chest pain is something that we don't play with, the king would tell you. If somebody comes to the hospital with chest pain, everybody is hands down. Like, if you're walking through the ED doors with chest pain, you're probably going to be seen first. So you will start to you will feel like chest pain, chest tightness around your chest area, and that is something that is not to be taken lightly. Even if you don't feel it anymore or it kind of subsides, it is very important. We recently lost one of our colleagues from our high school. He had experienced some chest pain like 3 months prior, and it went away. So he felt like there was nothing wrong. And, you know, 3 months later, he suffered this dizziness and just passed out. And so was taken to the hospital. They were able to revive him. And then they asked him what had happened, if he had ever experienced anything before. And he said, yes, 3 months back, he experienced something like chest pain, but it went away, so he thought everything was okay. Before he could get in the next word, he went into cardiac arrest, and they couldn't get him back.
Oh.
So your body talks to you, and so sometimes when these things that happen out of the ordinary, things that you would not have usually felt, and something like chest pain is not something that you take lightly. You will also experience lightheadedness. So, dizziness. And dizziness, is a lot of diseases that can cause somebody to be dizzy. But usually you experience symptoms in combination with other symptoms, or especially chest pain by itself alone is enough for you to go and get help. And along with that, you may have the lightheadedness. Another classic symptom is you experience pain or discomfort in the upper part of your body, so in the jaw area, sometimes in the neck, even your back, you may experience some pain and discomfort. And that's not, I mean, neck pain and jaw pain is not an everyday kind of pain. So you will know that there's something, and that may be indication that you may be experiencing a heart attack. There's usually something that also, most times when patients come in, they will say they have pain in their arm, their shoulders, radiating to their arm. That is also the kind of pain that you don't usually have, you don't normally have on a daily basis. Maybe the kinds of pain maybe we'll have on a regular basis, maybe like a headache, which could be like a number of things. But pain in your shoulders radiating to your arm is not an everyday pain. So another symptom your body is talking to you that you need to get help. And then you experience the shortness of breath. It's another word for that. The medical terminology for that is dyspnea. Okay.
So shortness of breath, meaning what?
You feel short of breath. You feel like you can't even get in
enough
air.
Okay.
Exactly. Like you. I don't want to say that.
You're panting?
Yes, yes. You are air hunger. You are hungry for air. It feels like you're suffocating.
Okay.
And that's shortness of breath. And you know it's not a symptom we experience on a daily.
It's not because you've been jogging.
Exactly.
Okay.
Exactly. You may not be doing anything, and you can feel shortness of breath. And so that is if dyspnea is a serious symptom. It's something that we don't play with. And so when you are feeling these symptoms, a combination, even one or two out of it, like I said, just chest pain alone or just shortness of breath alone is a sign that something may be going wrong and you have to get help ASAP.
Yeah.
And with chest pain, some people say if you're feeling the pain on your left side, then it's likely. Then if it's not on your left side, is that true or is it a myth?
So
Deacon will clarify that for you.
yeah, so I mean, there's something in it. So this is the thing. When you look at your chest now, the heart is, to your left side. Okay. So if something is happening and you feel it on the left, that is fine. But there is nothing that as soon as you see that the pain is not on your left, that means it's not. We can say that. Typically, most these like hand pain, jaw pain, they tend to happen on the left side. But it is not the only place that is going to happen. But maybe let me put one or two words in there for that. I mean, on that as well. Like what you said, there are several reasons why you can have chest pain. It could be just chondritis or something. This cartilage in the middle of your chest can be infected. Anything like that. Sometimes the chest pain is associated with chest movement or breathing. Yeah, in heart attack and stuff, it is not. Doesn't necessarily mean that it's associated with your breathing. You know what I mean? Like you breathe in deeper and then you feel the pain. Breathe out or you relax and the pain is not there. That is different. Just for heart attack, it is there regardless. And the classic word people come to the ED saying is that, doctor, I feel like an elephant is sitting on my chest. That is the term they use. And if somebody is also having a heart attack, one other classic symptom, it's easy them take this, something like that, grab that, grab the chest. You don't know. I mean, they've studied and found out that is typically something that happens.
Because they're feeling pain there and they're trying
for
to stop
some
the
reason,
pain
yeah,
with
you
their
feel like
hands.
yes, exactly. You feel like something is there, you want to grab it. But maybe to add one more thing, Dr. Kumsin rightly, outlined some of the classic symptoms and some not so classic, some that are not kind of gray area kind of symptoms. The interesting thing is that women tend to be more associated with the non-classic symptoms, the symptoms that are not the usual ones. Yeah, the back pains and all that kind of thing. Women tend to have that kind of symptoms. Men tend to have those what we call the classic symptoms, and so we want to take note of that.
Thank you very much.
And then also, when you're experiencing these symptoms, sometimes you may feel that, let me get myself to the hospital. It is recommended to call 911 versus drive yourself to the hospital because, as you know, 911 can get to you quicker, and even on the way, they can still be treating you. So let's say if it's a situation where your heart has stopped, they can revive you, in transit to the hospital. and will get you in sooner, maybe even an hour and a half sooner than if you were to drive yourself. And so that is something that we really have to take note of, you know, because sometimes people feel these symptoms and they feel like they want to just drive to the hospital, and that is where sometimes we experience things like there's a term in the medical, I'll call it DOD. You drive yourself there, you're suffering a heart attack, but by the time you get there, you're already gone, and that's DOD's dead on arrival. So heart attack is serious. You hear when people say it's as serious as a heart attack. Yes, it is that serious. Doesn't mean that you're going to die, but if you suffer a heart attack and you don't get help quickly, you could die. Because imagine if you're living alone and you're suffering a heart attack and there's nobody to help you. Time is of the essence when it comes to heart diseases. We talked last week about stroke, about fast, you know. So getting help quickly is significant, super significant, critical to saving life, because it could be something that you could have been saved from, but because help did not come quickly, you could die from it.
Let me really add something since you broached that topic. And that also relates to a question somebody asked last week on the stroke. On stroke, when we're talking about stroke, like what do I do when somebody's having stroke?
Right.
And we're thinking about what do we do, I mean, as an individual. You are there with your family. When it comes to stroke, there isn't so much you can do yourself. You would have to call 911, just as Doctor has said. Don't forget, like she said, they know what they are doing. When they come, they will start the treatment. They are trained to give you all that first aid, and even on route, they will be doing everything they have to do.
Which is a good thing to say, because sometimes we have the notion that when they come, they're just coming to transport you. So then you're trying to transport yourself. So don't be a hero. Call 911.
Exactly. That's a very, very good point. Yes. So you think that you want to transport yourself. I'll tell you one disadvantage with that. But if they come and they have to stabilize it right there before they even yank you into their truck, they will do that. They are trained to do that. If there's the need for some first aid medications, they are trained to give that. They can do so many things. Start an IV, start infusion, start so many things. So that is a very good idea. But think about it. When you drive yourself into the ED versus somebody who came in an ambulance, which one gets seen first?
Exactly.
So that is one reason why you have to call the 911. Besides, these teams, they have their ability, they are in connection or in contact with these health centers. They know which centers, specialize in which conditions. And so they know the right place to take you to. Besides, they have that connection with them. So even en route, whilst they are taking you there, they are on the phone alerting the hospital and the team out there that we are bringing the patient, this year old, this thing, all your basic things they have already given to them.
Exactly.
So the hospital has already started preparing and waiting for your arrival. So as soon as you go, you get yanking through straight into the system, rather than walk yourself into the front desk for somebody to wait and call you and do this, and before somebody gets to hear you, you are probably gone.
Yeah.
So don't really try to be a hero in these things.
Right. Thanks so much. If you're out there and you're listening to us, we are on Moments of Truth, and we are telling you about cardiovascular diseases, and we are talking about heart attack at this point. So let's find out, can we prevent heart attacks, or is it just inevitable? Or does it affect a particular age group?
So in terms of age group, I mean, of course, the older you are, especially 45 and older, you are at more risk. But there is nothing that says that somebody who is below that age cannot suffer a heart attack. I mean, I think that in recent times we see even more younger people suffer a heart attack. But is there anything particularly a person can do to prevent a heart attack? Probably not, because sometimes you're going to have a heart attack, you're going to have a heart attack. However, you can do things to prevent you having another one once you experience a heart attack. The evidence says about 20% of people 45 years and older who have suffered a heart attack will go on to suffer another heart attack within the first 5 years of the heart attack happening. So that is something to bear in mind when you are in that age range and you've already suffered a heart attack before, is to alert you that you have to be really vigilant and you really have to work very well with your PCP and really follow the directions and whatever changes they're asking you to do to prevent another heart attack from happening. And so what are you going to do? You are going to take your medication or whatever treatment plan that you've been put on. And again, when it comes to the treatment, depending on how much of a damage your heart suffered, is going to determine how you're treated. So it could be a total blockage of your heart or a partial blockage. And I think Deacon, say I'm not clinical, so I try to remember these terms. I think a total blockage is called a STEMI, or what we call the ST, elevation myocardial infarction. So myocardial infarction is another name for heart attack. Okay, so when you experience, if it's a STEMI heart attack, that means you had a complete blockage. Now, it could be a partial blockage, which is an NSTEMI, the non-ST elevation myocardial infarction. I'm right, Deacon, right? Mm-hmm. See, I'm not clinical, but I try to keep up. So depending on how the extent of the damage will determine what your treatment plan is and how the doctor is treating it. A lot of times, some of the treatment plan may overlap, but usually depending on the extent of the damage will determine how you're going to be treated. So make sure that whatever treatment plan, whatever medications that you're being given, you are taking them. If it was one that required some mechanical treatment, that you are abiding by the rules that the doctors tell you to. Also, you have to keep up your follow-up appointments. So if you're somebody who doesn't like to go to the doctor, who doesn't like to go for checkups, and you have suffered a heart attack, this is the time to change that behavior. So really, life after heart attack is a time for you to really change some of those self-care behaviors. Perhaps there were things that you had to do that you were not doing, and we talked about, could you have even prevented in the first place? I say yes or no, because if you have diseases such as high blood pressure that are uncontrolled, you have diabetes, you have high cholesterol, all these things predispose you to heart diseases. And so when you have these diseases, you want to be in control in terms of the management of these diseases so that it does not lead to a heart attack, to a stroke, to all these heart diseases that we talk about. Another thing, once a person suffers a heart attack, I think that usually when they come out of the hospital, Deacon, they give them a referral for cardiac rehabilitation. And cardiac rehabilitation is a rehab that helps people who have gone through who have experienced a heart attack to recover. So usually when you're coming out of the hospital, as part of your discharge instructions, they will refer you to a cardiac rehab so that you can really work with that supervised medical program to help you through your recovery. Another thing, you have to get support, and support in the community is very important. People have experienced what you have experienced before, and they have ways of coping. They have ways of changing their lifestyle to make sure that they're not experiencing this again. You can join some of these support groups in the community to get that help that you need from other people. I mean, who is the best teacher than the person who has experienced what you've experienced? So, and these supports are there in the community. And if you're not sure where to get these supports, always refer back to your primary care provider. Sometimes they can make a social work referral, and social workers are great with community resources, and they will channel you to the supports that you need to help you through your life after heart attack.
If you don't mind, let me just add, just stress on what something that doctor said. In fact, we make that, saying that prevention is better than cure. Mm-hmm. If it is ways to, technology abound today. And so after you suffered heart attack, there are several interventions that, you can go through. But I don't think that is why we are here tonight. We are here to help you to focus on the prevention side. We don't want you to have heart attack before you start getting, serious or doing certain things to prevent a second one. We want you to take it right from here, that prevention is better than cure. No matter how technologically advanced we may be today, there's nothing like nothing compared to not having it at all. In fact, don't forget that the Affordable Care Act, what we call Obamacare, came in. One of the key things was to stress on prevention. Your wellness care, things that you have to do before you even, get sick. So that is what we want to stress to you tonight. Live a lifestyle, and Dr. Crimson has, outlined a lot of them. Live this lifestyle that will not get you into that condition in the first place. Because once you get in there, bringing you, rehabilitating you to bring you back, it's a challenge. It's not like a given. You may or may not, live to rehabilitate. So let's, do that. Listen to your healthcare personnel, your doctors. Listen to your wife's men about what we eat, what we take in, and all that kind of thing, so that we don't get there. There are a lot of ways to prevent this. Don't be a statistic. There are so many people getting heart attack in a day. How many? They said once every 40 seconds or something like that?
Somebody gets a heart attack.
Yeah, once every 40 seconds, somebody gets a heart attack in the United States. You don't want to be part of that number, right?
So, yes. No, we don't want to be part of that. So that's why we are coming to your homes with this information on health, so we can all stay healthy and together be happy with this very happy community. So when you were talking, you mentioned living a lifestyle that will help you prevent.
Yeah.
And you mentioned eating. What else? Is talking about living a lifestyle that will help you prevent. What can you elaborate? What do you mean by lifestyle?
Yeah, let me start from the bottom. I mean, looking at our community, you can't talk about these things without even talking about smoking. Smoking is one big deal in this whole equation. The community we may be talking to may not have that big problem of smoking, but if you do, that is definitely not a good one. So smoking, using drugs, and all these things, street drugs especially, I don't mean you're using your medication, regular medication, but street drugs or prescription drugs that you are not using as prescribed, those are not good for you. Then we talked about the eating. I think I will leave the eating part to Dr. Kumsi because she specializes on that. But then don't forget about your physical activity, which is very, very important. Last week she stressed that be on the move, move. Walk, run. Have some way of making sure that you have all those steps in. Today you have gadgets you wear that people use to kind of drive them to be on the move, that they will look at it and say, okay, today I'm short of 1,000 steps or something. All those things help you. You will be on the move and you want to stay physical. And those are the key things we want to bring to you for now.
Okay. I have another question. Is there any test, like say how we go for our physical yearly? Is there any physical test you do, any test you do to see if you are on the verge or there's something to do? Is there anything
Absolutely,
like
that? There is. So that brings a very good thing. So your wellness visit, you have to go to your doctor, have routine visits. Don't wait until you are sick before you visit your doctor. That's something you tell them,
because sometimes you go, they just check your ear, check your nose, and that's personal experience.
Yes.
You feel like they are not really checking anything.
Something.
But they also do.
And then they tell you are okay. Is there anything in specific that you have to ask if you want to check your heart or something?
Yes, so that is, okay, I'm driving to that. Very good question. Yeah, so in your wellness visit, if you are focusing on your heart, that's why the doctors are trained to be there in the first place. They focus on your whole system, okay? So most likely they will draw your blood. And all those tubes of blood they draw will tell them a whole lot.
Yeah.
It will tell them a whole lot, trust me. Your blood pressure, at the very least, they will take your blood pressure and measure your weight.
Yeah.
Right.
That tells them a whole lot. Your doctor may put leads on your chest and get an EKG. In combination with a blood test he's taking, that will give him so you may not see anything invasive or anything, spectacular, but they are picking all those pieces and they know how to synthesize them, and then use them to draw the bigger picture.
So if you're out there, you really need to go.
Exactly. But to be specific, when doctor was talking about the genesis of all these heart diseases, one thing that was very ubiquitous in there was, blood, what your plaques build up in your arteries. That will cause the narrowing of your blood vessels, which, makes it likely for this, your vessels to be blocked. Whether it's going to be a clot or something else. So this plaque buildup, the plaque itself is very rich, it's cholesterol rich. So that is where you are getting all these things. So as the doctor draws that blood, he's going to check your cholesterol level. He's going to check all these numbers together, and he would tell you, he can, kind of get an idea that, hey, the direction you are going, if we don't put you on, say, statins, some cholesterol-lowering drugs or something, you may end up getting a heart attack or stroke somewhere down the line. So they have all these things in combination, like your body weight, BMI, and fat, body fat, and all that we spoke about earlier. All those things are going to go into the whole picture, and the doctor will use it to tell whether you are likely to get some of these things. And don't forget that we talked about hypertension. Controlling your blood pressure, it plays a very key role in this. The problem I have is that, and that is what we all have, is that hypertension in itself will not tell you. You will not know that you have hypertension until you take your blood pressure, you start checking it. And even if you checked it and it was high, it doesn't, probably you feel okay. So you think you are okay. Look, when you check your blood pressure and it's high, your systolic is greater, knocking upper 130s into the 140s, listen to your doctor. Usually when they first tell you, you go into a denial and say, no, it's not like that.
Yeah.
Can I tell you a little joke before I
tell
get to the
joke. Let's see the light side of this medical issue.
Yeah, so I have a friend who will want to, we would advise him and convince him to take his blood pressure. And I won't mention his name. So he would take the blood pressure, and if he gets a big number, 160 over something, he said, no, this thing is not correct. Then he would take it again, maybe one something, this is not correct. So he would take maybe 10 times, and as soon as he gets one good one, he gets up and, yes, you see, I told you it is good. He's forgotten that 9 out of the 10 were not good. My friend, when you start seeing that, it's time to listen to your doctor. I can't stress that enough. I don't want to take all your time, but we can talk about hypertension all day.
Yes. Thank you so very much. So if you're out there, moment of truth, and you do not believe so much in going for physicals because you go every time and you're told you're okay, it's better to go every time to check and be told you're okay rather than to be at home and then something happens suddenly. So please keep up your yearly checkups. They are very, very important. When you were talking, you kept talking about heart attacks. But I've heard of heart failure too before. Is it the same thing? Is it heart attack and heart failure? Is it the same thing or are they different things?
They're different.
Oh, how?
Okay, they're different. So your heart attack is when you experience a blockage in your heart.
And you feel the pain.
Yes, you feel pain. You feel
dizzy,
the lightheadedness. Yeah, and some of these symptoms are kind of similar, through the heart diseases. But your heart failure is when your heart is not pumping blood like it should to your body. So our heart is what pumps blood to the rest of our body. Sometimes in certain conditions, like a heart failure, your heart is not doing the job that in the way that it should. And it doesn't necessarily mean that your heart has stopped.
That's what I was thinking. That it's
Yeah, because
now,
sometimes people think when they hear heart failure, they think that, okay, their heart has completely
it's
failed,
no
it's down,
down.
totally down, nothing can be done
And
with
then
it,
you're
stop,
lying
and you
still.
are gone. No. No, because heart failure is usually a slow process. You know, you will start experiencing some symptoms, although it can be a sudden event, but it usually starts slow, and then it gets worse over time if it's not treated. But heart failure can be treated, it can be managed, and people can go on to live their lives like nothing is happening. But it is something, it is a chronic condition, and we also call it congestive heart failure. And once a person has a heart failure, you know, they really have to now work very well with their primary care physician and make sure, and even maybe social workers, even nurse case managers, for self-management. When you have a chronic condition, self-management is very important, because on your own every day, you have to know the symptoms to look out for, because it could be getting worse, or what would you see to make sure that, okay, I'm good, I'm on track. But we don't want you to have a heart failure, you know, so we want you to be on point with your high blood pressure. These are the same things that come into play when it comes to heart attack. You know, we want you to, you know, eat very well, keep a healthy weight, be physically active to avoid diabetes, to avoid high cholesterol, to avoid high blood pressure. These are the things that are risk factors for heart attack, for heart failure. And so these are all lifestyle and self-care behaviors that you can be in control of. But once a heart failure happens, it's a chronic condition, and it's going to be there, and things can improve, and then you can continue with your life. But it is a chronic condition, and a chronic condition basically means that you can cure it, but you can manage it successfully.
Let me get a clarification. So you're having a heart attack, we call 911. So you have a heart failure. What do we call 911 too?
Yeah, so not like, really. So that's.
I still don't understand.
Yeah, that's fine.
Yeah.
I'll let you. Yeah. So let me try and bring you in again. So like she said, heart failure is simply the inability, or the heart is not doing the job it's supposed to do. Your heart has not stopped. It's still beating. It's still doing, you know, apparently you look at it from the outside, you think it's doing what it's supposed to do.
Okay.
But the
You're not having that drastic
no,
thing.
it doesn't come with that. So let's say the quick, like we take something from what she said, then the quick one is that heart attack is happening here and now. It's an acute process, right? And then heart failure is a chronic, something you are going to live with. So it's not like acute onset all of a sudden, and you know you have heart failure.
Like a heart attack, yeah.
It's gradual, and then it's not something you are going to be cured. You have to learn how to live with it. And
right.
You know, yeah. And one more thing, heart attack can actually lead to heart failure.
Oh, okay. So I see the scale now. I see the scale of
exactly. Yeah, but yeah, to that point, yeah, heart failure it's something, and more often we talk about congestive heart failure, and as the doctor has said, it is the impairment of the heart's ability to pump enough blood to deliver oxygen to where they are needed. So the heart may be pumping like normal, regular, you know, level, but it is not delivering enough, you know, whatever it is. So we have something called ejection fraction.
Good.
That is how we typically diagnose heart failure, apart from the signs and symptoms. But ejection fraction is, let me say, one of the ways that we do that. Is the percentage, it's expressed in percentage. It is the percentage of blood that comes into your heart that gets ejected after contraction. So in other words, when your heart squeezes, what percentage of blood leaves the heart? Yeah. So if it is, you know, holding too much, it can't squeeze strong enough
to push a lot
exactly out. And it's holding too much, only a little percentage leaves, then you are probably having heart failure. There are a lot of distinction in there. I'll talk if I get a chance. I'll talk to you about.
Please, you have
but
the
chance. In numbers terms, your ejection fraction, normal ejection fraction is anywhere from 50 to 70%. In other words, for all the blood that comes into your heart, when the heart contracts, 50 to 70% for a normal person should leave the heart. If it is only ejecting anything less than 40%, you definitely have a heart failure. Some people, I've seen people who are, it's 15%. They are literally at end stage heart failure.
Yeah,
we can't do so
low.
much about it. So that is one thing we have to keep an eye on. And this thing is diagnosed with an echocardiogram. So your doctor may order an echo at some point to see how much on top. So you definitely, it's probably the symptom that will take you to see the doctor.
Right.
And then that is when all these tests come in to come and see whether you are having a heart failure or not. I believe we are going to be going into the details of heart failure because it's a big thing.
Yeah. About signs and symptoms. What do you want to say about heart failure?
Well, yeah, the signs, you started to say it. The signs and symptoms are important because that's what we're going to let you know that you may be experiencing heart failure or some heart problem of a kind. But specific to heart failure, you get the dyspnea we talked about, the shortness of breath. And so you get a shortness of breath. So normally when you do an activity, like let's say you climb up 3-4 flights of stairs. If you're not somebody who usually does that, the first time you do it, you're going to feel a little short of breath, right? Because you are not used to doing that. Now, that is a much different situation because, as you do that, more often you now start to feel not so much short of breath, and that is just a normal response to the activity that you did. And after just a little while, once you settle, you'll find. With this shortness of breath, though, you can experience with activity. So even the little bit of activity that you do, and it does not even have to be like climbing stairs, like you may walk from here to here, and you are like so short of breath, like you really feel like you're suffocating. Or you could even be laying down, and laying down you're not doing any, you're just relaxing, right? Even in your relaxed mode, you can feel that shortness of breath. Sometimes when you're sleeping in the night, it can catch you suddenly in the middle of the night, such that you even wake up, and then now you can't even go back to bed. So it is very, and that's not normal. See, that is the difference between what is the normal and what is not. The short of breath that is normal versus the short of breath that is not normal. And that's one of the ways that you can see. You may also feel lightheaded, dizziness, and that's because there's just fluid buildup in your lungs, and fluid buildup. When you get a heart failure, fluid builds back up, blood builds back up into the pulmonary veins, and so your heart now cannot keep up with the supply, and so the fluid starts to leak into your lungs, and that is what causes that. You may also see wheezing and persistent coughing. So again, to be able to distinguish between like a regular cold kind of cough versus the kind of coughing that is associated with heart failure, and usually when you cough, you may see that your sputum or the mucus that comes out is either white or sometimes it may be pink. It looks like blood stained. When you see that, obviously that is not normal. So now when you see a white clear one, you may not immediately feel that there's something wrong, but you're usually going to experience this in combination with other symptoms, and that will alert you to know. And usually that coughing and the wheezing also comes from the buildup of fluid in the lungs. There is a question that usually nurses, when they're assessing people with heart failure or suspect, they will ask, do you sleep with 2 pillows to get comfortable? So usually people experiencing this may require 2 pillows and have it propped up in a way just to try to get comfortable. And that is not your regular sleeping pattern. Usually, a normal person, one pillow should be fine. But when you're constantly requiring two pillows and you have to set it up in a way just to try to even get comfortable, and it's very hard to do, it's definitely a sign that you may be having a heart failure. It's time to really go see your doctor to check you out. I want to talk about edema or swelling, because you have leakage fluid backed up in your tissues now. So now you see swelling on your ankles, on your feet, even sometimes in your abdomen. And edema is not normal. That kind of swelling is not normal. It may be normal sometimes with a woman who is pregnant, but outside of that, edema is not normal. Even with pregnant women, sometimes you have to check to make sure that it's the normal type of edema. Because see, edema, sometimes when you have a swelling and you put your finger in, it sinks. When it sinks, and
it stays there a little bit.
Yeah, and then that's not normal at all. So that will alert you that there may be some problem with your heart going, and especially when you're feeling all of these symptoms happening. And like I said, it's a slower progress. It's a much gradual, and so you may not feel the need. Like, just don't keep ignoring the symptoms.
Just because it's not acute.
Yeah. You have to get it checked. Anytime you experience something outside of what your body normally tells you outside, and it could be something as a headache, and sometimes people get headaches upon headaches, and they never really follow up. Right. Whatever it is that your body, because those symptoms, that's how our bodies talk to us. And so when you start to experience those, that is definitely time to go and seek medical attention.
Yeah, so again, thank you. You kind of covered heart failure a whole lot. Just trying to, again, sound the alarm that we said that it's a slow, chronic process. So take it from the beginning. It might start, they have a classification for it, that you may be stage 1, stage 2, stage 3, I don't know, or A, B, C, D, depending on which classification you are looking at. So at some point, some people have the heart failure and they don't show any symptoms. And gradually, I mean, you may see very slow symptoms. Some of them, it starts like you have to do something vigorous before you start seeing the abnormality. And for some, it starts with just having the risk factors in place. And then now it gets to the point where you are seeing something when you do something vigorous. And then gradually it gets to the point that you haven't done so much, but the way you are getting tired doesn't even correlate. And it gets to that point where you haven't done anything and now you feel the symptoms.
It's a progression.
Yeah, and so the thing is, let me try to connect this. The heart pumps blood from to the other sides of the body. The kidney, every ounce of that blood passes through the kidney. And in the process, the kidney is taking away all this waste stuff, getting rid of excess salt, getting rid of excess water, getting rid of some of the byproducts of the things in our system. However, if the kidney sees less blood coming to it, the kidney tends to think that, oh, we are short of blood, let me hold on to fluid. So the kidney will hold on to salt, and the salt will pull the fluid in. So that's why you retain all those excess fluid. Some of those excess fluid is what will come to, into your lower extremities to see that edema, and some of them will back up into your lungs. Yeah. Don't forget that we said that the heart ejection fraction, when we said that the heart is pumping, 100% comes in, the heart only pushes 10%, right? Let's say 20%. And then the body is still bringing more, and that's when you start getting the backup into the system. So there are two ways that you are holding on to this fluid. And so these are things we have to look at, and those are signs. And the edema Dr. Kumsin was talking about is usually bilateral, it's on both sides. So if, let's say, one of your leg is swollen and painful and warm and something, it's a different ball game. You need to see a doctor for that. But for heart failure, it's going to be both sides. Legs. Usually your ankles, puffy. You press on it, you see the little indentation and all that. So let's look at those signs. And again, like doctor has said, anytime you see something unusual, that is not me. This thing was not there a month ago or last week. Or when is this coming from? It's time to begin to ask the questions and try to seek help.
Oh, thank you so much. So our time is fast spent, but I want to ask this question. So you've been diagnosed with heart failure. Now what?
Yes. So you've been diagnosed with heart failure. It means, like we said, it's not something that will be treated. We don't have a magic pill that you take and your heart failure is gone. So now it's time to modify your life, live according to instructions so that you have as normal life as possible. Yes, and this is comprehensive. It's time to listen to what they tell you, your food, the salt content and all those things, your exercises. And don't forget that now that you have heart failure, your capacity, vital capacity is gone. Your capacity to do exercise itself is kind of decreased. So don't overdo it. You have to listen to your doctor to see the extent of things. This is not a time to try to be
jogging all over town.
Now I have to do it so that I can reverse it. It's good, but yeah, you want to be careful listening to your doctor on those things.
And like we explained before, heart failure is a chronic condition, and so self-management is key. There are some action plans or self-management, if you will call it, plan that are available that kind of tells you the symptoms that you see that tells you that you may be in the green, and green means that you're doing okay, keep doing what you're doing. And then it goes on to show the yellow, which means caution. You have to pay attention here. If you see this, if you have a sudden weight gain of 2 to 3 pounds in a week, even 5 pounds. I've seen people gain like 10 pounds in a week. That's caution that your heart failure is not being managed very well, and that it's time to talk to your doctor. When you move from that yellow range into the red zone, you need to call 911 because now you are worse off, and you really shouldn't wait to get to the red zone, because if you have that action plan, you can always ask your doctor. They'll show you. There are some of them that are available in American Heart Association. There's an organization called Rise Above. It's a self-check action plan that really helps somebody to really, who has a heart failure, to really guide them to know where they are, because if you're gaining weight like that and you have heart failure, that you're doing something you're not supposed to be doing. You're not following the instructions and the medication plan and the treatment plan that has been prescribed to you by your doctor. And so that is that action plan has worked very well in most of the patients that we've worked with, and we have managed in terms of just helping them in the community manage their chronic disease. Has been so helpful because it's something that they can look for on their own to know, and they can tell themselves, oh, it's time for me to go in because this looks like that and this looks like that.
Awesome.
So yeah, to add a little to what doctor just said, don't forget about the fact that you said that measure your weight daily. You want to monitor. That is a quick and very effective way of knowing that you are retaining fluid. And these are the fluid that is going to cause the edema, the swelling, the lungs being flooded and all that. So think about it. If you gain, water is very dense. So if you hold on to 1 liter of fluid, 1 liter of water, 1 liter of water weighs 1 kilogram. So if you body weight shot by 3 kilograms in a week, it means you are holding on that much of water. So one big part of managing heart failure is to decrease the volume, your fluid amount in your system. They give you what locally they call pee pills, Lasix mostly, to let you pee those fluid out, draw those fluid and pee it out, so that you manage the volume, because the heart remember, it's not strong at this point to be able to withstand all that volume and pressure in there. So you kind of, diurese and get rid of the fluid. And so that is very important. If you start gaining weight, then it means that your fluid management is not working very well. And don't forget, salt, one of the things salt does is to help you to hold on to fluid. That is why they will stress that, watch the quantity of how much salt you eat and stuff like that.
Yeah.
Right.
Remember, your kidney is already being full to hold on to salt and fluid. And so that is all tying into that equation. So, yes, be careful with weight. That is the basic thing you would look at. But, again, don't neglect what your doctor is saying, because taking care of this and living a normal life needs a lot of very, tricky management. It's a combination of lifestyle changes and medications. Of course, there are medications that will help your heart to pump a little stronger, be more efficient, but it won't bring it back to where it was before.
Right.
So you have to combine that with other things. I don't want to,
Oh, we really, really have enjoyed you this month. God bless you very much, Deacon Gate and Dr. Prissy, for all the health tips that you have brought to us. Viewers, please take these health tips and use them, because we want to have a healthy community, and they have spent their time just pouring in and pouring in and pouring in. May God bless you. Thanks to our viewers for joining us. We appreciate you. Send us your questions. Send us your thoughts. Send us your suggestions. Go ahead and let us hear from you. That helps us to know what you would like to hear. Also, we thank our technicians and our technical crew very much. God bless you for all you do. We are thankful to Ashon Collections. Ashon Collections, if you want your electronic gadgets, contact Ashon Collections at 02435-48925. Also, we're thankful to El Shaddai International Market. The address is 2620 Annapolis Road, 7 Maryland, 21144. We are thankful to Lean On Foundation and Ministries for your help and your time. Thanks also to our national head, Apostle Amoako, and to our regional head, Apostle Asemno. And thanks to Reverend Elvis Boateng and his wife and family for all you do and for bringing Adonai to our homes, offices, and everywhere we are. Until next week, same time, meet us again at Moment of Truth. God bless you. Stay blessed.